What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
We get it. Distractions happen. That's why we designed the fully electric, full-sized Volvo EX90 with the latest technology to keep you and those around you safe. Its 2-sensor driver understanding system is designed to prevent distractions and help you stay focused. Reserve your Volvo EX90 today. Learn more at volvocars.com/US.
I was gonna tell you a sock joke, but I got cold feet. How is a private eye? Like the dry cleaners? They both do other people's dirty work. Why did the baseball catcher spend a night at the field? Because he felt right at home.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Goldstein Network Studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. Please don't forget to check out stuff.drsteve.com, stuff.drsteve.com for all your Amazon and online shopping needs. And tweakedaudio.com, offer code FLUID for the best earbuds for the price and the best customer service anywhere. And Dr. Scott's website at simplyherbals.net. Check out Tacie and me at patreon.com/weirdmedicine. Patreon.com/weirdmedicine. We've had the Troika on now. We had Jim Norton, Greg Hughes, and Anthony Cumia, and they were all fun and very different, and but loads of fun. It was really a lot of fun. Mm-hmm. And then we've had Mark Normand and Joey DeRosa, Bobby Kelly, and we've got more coming. So hang in there on that. And check if you want me to say fluid to your mama.
It'll cost you $5.
Yeah, well,
$5.
I don't know what it is right now. I keep changing it. I just mess with it all the time. It's very inexpensive, whatever it is. Go to cameo.com/weirdmedicine, and I'll basically say anything you want me to within reason. All right? And within reason for me is I've got a pretty broad range of things that I'll say. So.
The threshold's pretty low.
Yeah. It's fun, though. I have fun doing it.
That's cool.
All right. Well, Dr. Scott, how are things at simplyherbals.net these days?
Wonderful.
Yeah, check them out at simplyherbals.net. I tweeted something out about you. I said, I don't say, enough good things about you. I like making, tweaking you from time to time about your East Tennessee pronunciation of some medical terms. But, you're a good friend. You're always here, and simplyherbals.net is your jam. So I should plug it more often. So.
Well, thank you.
People can check it out. I might, might be an interesting thing. You've got that fatigue reprieve shit on there.
Love it.
First off, this is not a commercial, but I am still, despite my BiPAP, and it's better, but today I was using my eyebrows to keep my eyelids open on the way home the last, mile and a half.
Oh, gosh.
And I was going to pull over, which is what I've told everybody that they should do, because my brain is trying to kill me.
Yes.
And why, I don't know, probably because I'm an asshole, but my brain is trying to kill me. And so, the protocol is you pull over and get something to drink and then, walk around for a bit, get back in your car, you should be okay. Or take a brief Thomas Alva Edison power nap. You hold a pen in your hand or your cell phone, and then, when you fall asleep, you drop it, wakes you up, and then you get on your way. But I take medicine for this, and it still doesn't work. So I thought maybe I'd try some fatigue reprieve, do a study, an N of 1, just to see if I can tell the difference.
Yeah, I think it'd be a good idea. I'll bring you some.
So I'm asking for is free.
Yeah, I got free
stuff
for you, Dr. Steve. I got free for you.
The new medicine isn't helping you?
No, I can't get the new medicine because my insurance won't pay for it. They've put in a prior approval twice. Even though they've said we have a physician who has a huge territory, drives all over creation. I drive 2 hours a day sometimes, sometimes longer than that. Yep. And the standard stuff, modafinil, isn't cutting it. And now, if I do a modafinil and a sugar-free Monster Energy drink, I'm fine. But that doesn't seem like what I should be doing.
Yeah, I've got something a little bit better. We'll try the.
Oh, okay. Well, you say it's better. We'll see. You may be right.
Maybe the two together would be great.
Yeah, maybe so. So anyway, we'll try some fatigue reprieve.
You're bouncing off the wall.
It's very cleverly named. Yeah.
Well, thank you. I hope so.
So anyway, check out Dr. Scott at simplyherbals.net. But it's not a commercial. I'm just really, I'm a little bit desperate at this point.
Yes, I'm here for you.
Wanted to say happy birthday to our network forebear, but the person who created our network, Cardiff Electric. So happy birthday, sir. And I hope you have a wonderful one at the beach this week. So there you go. He's going there for his birthday.
Hey, Sean just got back from the beach.
Sean Pedrick?
Yeah. I need to go to the beach.
He's my date
that's what
to
I heard.
This is my life. I'm doing a weekend away, and my date for this event for the whole weekend is Sean Pedrick, everyone.
The one and only.
Yeah. And Tacie, I think he's probably a snitch. So if he'll be a good chaperone. He'll make sure that I don't do anything stupid.
Okay.
Yeah, we're worried about that.
Like Tacie's wife. I'll do lots of stupid things, but not that kind of thing you're thinking about.
Right on.
Wear it out.
So anyway, yeah. Sean won the free tickets to the Creep Off Roast. You can go to creepoffroast.com. You might be able to watch it live. I don't think there's any tickets left. It's in Rochester, New York, September 17th. It will be my first and my last roast, where I'm not the roast master. That would be Vincent Paulino, everybody.
Oh, cool.
He's the resident, or the comic in residence at Comedy of the Carlson, where this thing is.
Mm-hmm.
And there will be some other actual comedians there, and then some other people from the Creep Off podcast. If you don't know what that is, it's in the WATP universe, but they don't goof on podcasts and get in trouble and stuff. They goof on criminals.
Oh, geez.
So it's a true crime podcast, but it's a comedy true crime podcast. Both of them, the hosts are very funny, and each one picks a theme. So when I was on the show, they did creepiest medical professional or creepiest doctor, and so each person tells the story of their creepiest person, whatever the theme is.
Their encounter?
Yes. And then their story. No.
Oh, okay.
No. It's you find somebody in history.
Okay, gotcha. I'm sorry.
And then you tell the story, and then the audience gets to vote on it, who had brought the creepiest person. And if you lose 5 times, doesn't have to be 5 times in a row. The first person to lose 5 times has to spin the wheel of consequences. And then they have to do whatever it is. So one of the hosts, Carl Hamburger, had to wear a cow bikini on the show on camera for the whole show. Vinny Paulino had to do the polar dash on one. And then that's still in dispute because they were videotaping him, and then the person just forgot to videotape him actually going in the water and coming back out. So now people are saying he never did it, even though you could tell how miserable he was when they finally caught up with him afterward.
Funny.
So it's a funny show. Go to creepoffroast.com, or you could check it out at the creepoff.com if you just want to listen to the podcast. If you're into true crime, it's a fun one. I've been trying to get Tacie to listen to it because I think she would like it. She likes true crime. Did you ever listen to one?
No.
There you go. Vinny and Carl. There's your endorsement from Tacie. Now. All right. So there you go. Scott, you have some topics for us today?
Yeah, I've got one you sent me about the gorilla.
Yeah, let's talk about this. This is crazy.
Yeah, so Dr. Steve found this article and sent it to me the other day. It's The Invisible Gorilla Strikes Again. Sustained, and here's the topic, sustained inattentional blindness.
Right.
And expert observers.
Yes.
So real quick, here's the abstract. We like to think that we would notice the occurrence of an unexpected yet salient event in our world. However, we know that people often miss such events if they are engaged.
Humans are the worst witnesses.
If they are engaged in a different task, the phenomenon is known as inattentional blindness. So you're just not paying attention. So what they did was they took there's been multiple studies, but this one.
Talk about this one. This is crazy.
This one is. We asked 24 radiologists to perform a familiar lung nodule detection task. A gorilla, literally a gorilla. I was shocked when I looked at it.
Yeah.
A gorilla 48 times larger than the average nodule was inserted into the last case. 83.
Oh, wait, so it wasn't a gorilla's lung. They actually took a gorilla?
A picture. Dude, that's the craziest thing I've ever seen. No, honestly. But check this out. 83% of the radiologists did not see the gorilla.
Well, they said it was a nodule? They said there's a large nodule?
No. Check this out. 83% of them did not see it. But what they did, it was kind of a cool study because what they actually did, though, they monitored, they used the tracking, and they could actually see the eye movement of the radiologist.
Yes.
And they not only did they just missed the piss out of it. They even looked directly at the gorilla
and still
didn't register. So even expert searchers operating in their domain of expertise are vulnerable to inattentional blindness. Isn't that crazy?
Yeah.
So Dr. Steve, they showed, and look at this, Tacie. They literally have superimposed an image of a gorilla waving.
There's this thing called the invisible gorilla test. That's why they use gorillas for this.
It's crazy.
There's one called the invisible gorilla test from 1999. And what they did was they watch a people video, and you can see this on YouTube. Just Google it, or go on YouTube and search for it. They watched a video of people dressed in black and white passing basketballs. Participants were asked to count the number of times the team in white passed the ball, so they gave them a task.
Right.
During the video, a person dressed in a gorilla costume walks amongst the two teams, and then the participants were asked whether they had seen anything unusual in the video. Nearly half the participants provided negative responses. In other words, they never saw the gorilla.
Right.
That's so crazy.
It is insane.
And I've got a link. If you remind me, I will put this on our YouTube page at youtube.com/weirdmedicine. It's so nuts.
Hey, and can I tell you something about this? So I really felt this was so compelling. So when I was reading this, and I just did what I did to Tacie, I scrolled down and I looked at these images, and I looked all over this thing. For the first image, I said, well, heck, there's no gorilla in that. And scrolled down to the second one, I didn't see anything. But sure enough, do you see the gorilla in there on that image?
So Tacie's looking at it.
Poodle.
No. So, Tacie sees a poodle. So here's the crazy thing. Now that I've looked at it for the fourth time, I actually can find the gorilla. But I think what those radiologists they're so trained to look at very specific things, kind of like with those balls.
Yeah,
you just miss it.
Yeah.
And
yeah.
I literally just now saw it when I was
even though you knew,
even though
you
it
were
was there.
trying to make fun of them.
Yeah, I knew it was there.
It.
Yeah, it's crazy. But now it's crystal clear. It's right there.
Yeah.
Upper right corner.
Well, nobody can see it because this is a radio show.
Oh, yeah. Well, you'll have to trust me, guys.
Yeah. Google this stuff. It's pretty crazy.
Mm-hmm.
And I have heard of other for some reason, they always use somebody dressed up in a gorilla suit.
Mm-hmm.
Where they'll
because it's like
they'll do forensics.
Yeah, there's no way you could not see a gorilla.
They'll say right.
Yeah,
that's right.
That's why
because it's so weird.
There's just no
that they'll do these forensic tests to demonstrate that people are terrible witnesses, and they'll have a crime going on, and they'll say, now watch, try to get all the details of the criminal and all this stuff, and then they'll have a gorilla walk through, and nobody will notice the stupid gorilla.
Pay attention to their hat color or whatever.
They should put real gorillas in there. I bet people would notice that.
Isn't that funny? Yeah, but I'll tell you, Dr. Stephen, and when I was reading this, it brought me back to my days playing baseball and how when you're so focused on an image, like specifically when you're trying to hit a baseball, which is the hardest thing to do in athletics.
Yeah.
The more you can block out everything else, the better hitter you are.
Yes.
And the hypothesis the hypothesis is that because Ted Williams is the greatest baseball hitter in history. The only person ever hit over 400. They said it's because he trained the occipital part of his brain, the visual cortex, to focus because he was a fighter pilot. And they used to line up planes and fly like 20 of them in a row and fly by each other, and they'd have to identify each marking on each plane.
Yeah.
And they think that's why he was such a great baseball hitter.
Is that right?
Yeah, that's what the.
Isn't that interesting?
Yeah, so that's.
Well, you absolutely,
because you're just.
If you've ever played, even at a semi-elite level, you understand that whole Zen thing where you're not thinking and your brain is hyper-focused on what you're doing, but without any effort. Yep. And that's the key.
Yep.
And that's what our son will be training people to do, Tace, because he's getting his PhD in sports psychology. So there you
go. Hopefully.
If anyone is interested in looking at that selective attention test, whenever you happen to be listening to this, go to my Twitter at Weird Medicine, and I'll tell you what, I'll pin it to the top. I'm going to pin it to my profile, and then you'll be able to see it at the very top. So just look at my profile. I just stuck it up there now. All right, cool. Anything else on that?
No, that's it on that one.
All right, you got anything else?
Yeah, I actually did find another interesting one. This is from the Holistic Nursing Practice magazine. Mm. They do a lot of good solid research.
Do they?
They do good solid.
Okay,
research.
I'm not saying that like Jim Norton. I'm not saying do they. I'm saying do they really?
Oh shit! I hit the wrong button. Son of a bitch! No, I'm sorry. Here we go.
Because you're an idiot.
That is the truth. All right. So, should acupuncture-related therapies be considered in pre-diabetes control? research from, and you're going to love this, a systematic review and meta-analysis of randomized controlled trials, Dr. Steve.
That's better than shit.
Yeah.
It is. It's better than shit.
No, is it perfect? No, but it's...
And then you got to determine that the studies that they did were good studies before you mush all the data together. So for people who are listening that have not listened for a long time, don't know what we're talking about, this is where you take a bunch of smaller studies and mush all the data together to get a bigger study so you can see if you can get statistical significance out of the data and make some conclusions. But anyway, go ahead.
So anyway, they were assessing the effects of and safety of acupuncture-related therapies on glycemic control for prediabetes.
So blood sugar control.
Yes.
Okay, so tell me how they constructed these studies.
855 identified trials, 34 articles, qualitative synthesis, 31 were included in the final meta-analysis. So what they did
was they had 850 articles. Yeah. Out of that, only 30 had data that they felt was worth mushing together.
Right, yeah, the criteria met their criteria.
That's a pretty sad, ratio. But anyway, okay, so they found 30 studies.
Yeah, but at least that's 30 more than more than one.
It's more than 29. That's right.
It's better.
Dr. Scott's good at ciphering.
I'm good at ciphering. I'm pretty good at them gazentas.
Yep.
Them gazentas.
3 gazenta 9, 3 times.
I think it's 3 times. So anyway, compared with usual
2
care,
goes into 4 twice.
Compared with usual care, sham intervention or conventional medicine.
There you go. Okay.
The acupuncture was found to be significantly better by lowering fasting plasma glucose.
Okay.
The 2-hour plasma.
It's because they
glucose.
make you lay there for 2 hours. They can't eat.
And glycated hemoglobin. So, yes, you're right. We starve people to death while we're treating them.
Yes, I've done it. I know what it's like.
We're skewing the outcomes.
Yeah, no, but okay. So what acupuncture did they do? Did it matter what part of their quadrants or whatever you call those meridian points or whatever that they did, or can you just stick the needles anywhere? End of your dick, tip of your nose, what?
Pretty much.
Under your fingernails?
But if you have one going on the end of your dick, you probably should
well, I'm
find
just saying.
somewhere else to go, yeah. But no, there was not a specific protocol listed in this.
So just stick them anywhere?
Well, what they're saying is because it can help with overall health and well-being. It helps to lower your stress levels.
Yeah, that I can understand. The cortisol.
Cortisol levels and
the process.
Yeah. But so in other words, all they said was that having the acupuncture treatments for whatever, and Dr. Steve knows as well as I do, if it's for pain, we do really well with a lot of types of pain.
Yep.
Lots of stress.
I'm just trying to figure out what the mechanism would be.
Yeah, it's got to be lowering serum cortisol, increasing serotonin.
That's interesting.
Yeah.
It has to be. This would be my guess on the mechanism for this.
Mm-hmm.
Is that when you go to an acupuncturist, it's one of the most relaxing places. To me, it's more relaxing than a spa because at a spa, you got like hot men and women, looking at your, looking at you and stuff, and looking at your jungle region and making internal, evaluations and stuff, and it's to me that's stressful, and I don't want people messing with me when you're at the acupuncturist. Well, Tacie, you talk about it. You gave me a thumbs up on that. Talk about what it's like going to the acupuncture office.
It's nice. I mean, I was very surprised. I didn't know what to expect, though.
Right. So what did they do to you? And when I said it's very relaxing, you went, mm-hmm. So
put me in
what's that about?
A cool, darkish room.
Yes.
Stuck me with some needles and with a TENS unit.
TENS unit, yep, on her.
And left me alone for how long, Scott?
About 20 minutes, yeah.
And when they came back in, I didn't want to leave.
Yeah. It is intensely relaxing, and that will reduce stress hormones, epinephrine, cortisol, that kind of stuff would reduce blood sugar. So what I would like to see is maybe there are studies on this, on acupuncture, the whole thing, not just coming into a laboratory and they're sticking needles in you, but they're doing the whole process.
Yeah.
If you can show a decrease in, say, circulating epinephrine, circulating cortisol and stuff, because that's good.
Mm-hmm.
Then the question is, do the needles have anything to do with anything at that point?
Sure.
Is it, could you do the same thing without it or with some other thing? And there are other interventions that might do better, or needles with different electrical frequencies.
Yeah.
I mean, there's all kinds of cool things that you could look at.
Yeah. Well, one of the things that I use the TENS unit for is because they've shown that by using electricity on the needles, it stimulates the mu-opioid receptor stimulating hormones in the brain.
Right. I can see that.
And it increases serotonin in your spinal cord.
So stop with the jargon. Explain what that means. When you said it stimulates the mu-opioid receptors in the brain, people are just like, ooh.
Yeah. So just
emotional damage.
Yes.
Well, I mean, what does that mean?
Yeah. Well, by putting a needle, just by sticking a needle in through the skin, it stimulates a response. So if you just do plain needles, because we get this question all the time about the difference between dry needling and using electric acupuncture. One of the reasons the dry needling does work is because it stimulates the peripheral nervous system.
Okay, what does that mean?
Well,
peripheral.
It's anything outside of the
uses
spinal
all
cord.
kinds of fancy words
anything outside the spinal cord and brain. So the nerves outside the spinal cord and brain. And it works very similar to the way an Advil or a Tylenol or an aspirin is for helping with that pain. Okay.
By a completely different mechanism.
Right. Okay. And then by using electrical stimulation to it, it stimulates the brain to release more of an opiate through your system.
Yeah.
So we're actually working on treating pain from a couple different approaches.
There are endogenous opioids. Those that means made from the inside your body. The reason that when you take heroin that it does something is because it attaches to receptors that are there, that were already there for internal drugs that look like heroin. You have the same molecular structure and they operate the same way. That's when people get addicted to running, like my friend John, who is now is he in the chat room today?
Yeah.
He is?
He was earlier, yeah.
Logan Field is?
Yeah,
he hasn't missed running one day, and I think he's like at 1,000 days or something like that. May even be longer than that if he's still in there. See if he chimes in on that. But he won't miss a day.
Yeah.
And like if he does surgery, I said, "What happens if you have to go in for surgery?" He said, "Well, I have to start all over again." But if it's raining, snowing, he is out there, and I postulate that he may be addicted to the endorphins. In other words, endogenous opioids, molecules that are made inside the body that stimulate the same receptors that Lortab and Percocet and heroin do.
Yeah, Roxy's, Oxys.
Yeah.
All the
Need
good
my
ones.
hydros.
All the good ones.
Give me some hydros
Yep.
and some Oxys and some Dilaudid.
I like to pull up. One of our dear friends is a pharmacist, and sometimes I'll pull up, and if one of the girls there doesn't know who I am, I'll say, "Oh, hey man, can I get some Lortab?"
I do the same thing. There's a pharmacist in town. I was there when he was born.
Oh my gosh.
And his mom his dad was my best friend in residency, and I'll always call him and go, "Now, Colton, I need me some of them Lortab 15s." Of course, they don't make such a thing. And he'll just go, "Come on," because he knows it's me. It's so stupid.
Oh, I love it.
Well, for people who think that acupuncture is just complete horse shit, part of the problem is that some of your fellow practitioners have not been helpful to you in that regard.
No, you're correct. You are correct.
But the type of things that Dr. Scott does, there's really good data behind it, and it is drug-free. You're generating the drugs inside your system, and anybody that wants to, argue with us about that, I'll defend Scott on the things that he does because he does the things that he knows have data behind them.
Right.
And you can go to PubMed and you can find tons and tons of articles that show that there is, a positive net effect with acupuncture when used under the correct
and used in the right things, right?
And this article here from Medical News Today says, its conclusion is, shit. Let me get to that because whoa, you son of a bitch!
Come on!
Good God!
God, man.
Anyway, now I can't find it because it scared me so much that I hit my mouse.
What was that?
I don't know. Honestly, I don't know.
It's the spooky show, y'all.
It's a spooky show.
That acupuncture is safe and effective when done by somebody, basically, to paraphrase them, who knows what the fuck they're doing.
Right.
So you go to someone that's taken a weekend course, they can kiss my ass for the most part.
Yeah, me too.
Dr. Scott spent 4 years of his life in traditional Chinese medical school, and I respect that. Anybody that gives up that much time and effort studying all this stuff, deserves your respect. Now, for the effort put in, and there's a big difference between people that come out of your office, because my cancer patients go to you.
Oh, yeah.
100% of them feel better when they come out of there.
Yep.
Whatever it is, who cares what the mechanism is?
Yep. As long as it works.
So anyway, all right, enough with and now I'm starting to sound like a kook.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
We get it. Distractions happen. That's why we designed the fully electric, full-sized Volvo EX90 with the latest technology to keep you and those around you safe. Its two-sensor driver understanding system is designed to prevent distractions and help you stay focused. Reserve your Volvo EX90 today. Learn more at volvocars.com/US.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
This episode is brought to you by Pillsbury Toaster Strudel. Make every morning a memory with Toaster Strudel, a fun, convenient, and sweet part of breakfast. Made with sweet filling, creamy icing, and flaky crust, and prepared in minutes in the toaster, oven, or an air fryer. They're the perfect answer to your on-the-go breakfast needs. Mornings are better together with Toaster Strudel. Pick up Toaster Strudel on your next shopping trip.
Pasajeros a bordo, bienvenidos al Friskies Express. Por favor, mantengan sus patitas y colitas dentro del tren. A su derecha verán Crunch Canyon. A la izquierda, Filet Falls. Ahora pasamos al Pico Party Mix. Hoy el tour delicioso está por terminar, pero no hay problema, porque con Friskies siempre hay algo más para explorar. Ve a friskies.com para explorar más.
All right. You got anything else?
No, that's it.
Promoting your own shit.
No, I was like Kirby saying, would y'all
show.
take a question?
Yeah, go ahead.
I think no. He said, "Would we take a question?" But
Yes, of course.
No, he's telling us to take some.
Oh, okay. 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 Fair enough. Fair enough.
Number one thing: don't take advice from some asshole on the radio.
All right. Let's.
Okay.
This is Lee
Hey,
in
Lee.
North Alabama, and I've got a question regarding some HRT that I'm doing.
Okay, HRT being hormone replacement therapy, presumably testosterone, but not necessarily. We'll see.
When I did my last blood sample, I was at a 200, and so.
Okay, so listen, when we give out these raw numbers like this, we're not using the units. I don't know if he's talking about nanograms per deciliter or what the units are, but I'm assuming that's low, and if it's low in his lab, then the low normal in most labs is right around 350 if I'm not giving out the units, and normal is anywhere considered to be 350 to 850, somewhere in there. Depends on the lab, so you got to look at the normal range. But just remember that if you're in the low normal range, you're probably actually low.
And if you feel bad and you're in the low normal, that is
there
important.
you go, Tace. You're going to get one of those.
Give yourself a bill.
That is exactly right, because symptomatic people in the low normal range have been shown in studies to derive benefit from treatment from hormone replacement therapy, even though, quote unquote, technically they're in the they're technically, quote unquote, low normal or normal, and they're not. It's because there's so many people are low that when they determine what's normal, they're including a bunch of people that are low because they've never been diagnosed in that average. And so it skews the normal range low. So all of the urologists that I've talked to say if you're low normal and you have the symptoms of low testosterone, that you should be treated. Okay, anyway, let him complete.
Through some doctor guidance and stuff, we've started the therapy. I'm doing injections.
Okay.
Every 10 days.
Okay.
And so
there's lots of things you can do. He's he's giving himself shots. Mm-hmm. Some people do the gel. Mm-hmm. Some people do pellets. There's all kinds of things you can do. So
injecting in my left leg because I'm right-handed. I can control it better. And I inserted the needle into my leg. This was a week ago.
Oh, no.
And when the needle went in, that area and that muscle where the needle penetrated my leg cramped, and the needle actually racked in one direction and then stood back up. And I pulled the needle out, and I managed to get the injection in.
Yeah.
But I'm curious, why in the world would it have done that? Did I hit something?
Yes.
Or
you stuck a needle in your leg. Well, that's what you hit.
I just don't want that to happen again because it hurt like some bitch.
Yeah. Go ahead, Scott.
I would say it sounds like the motor point in the muscle.
Yeah.
So it's kind of where the nerve innervates or enters the muscle. And it's the biggest bulk of it. And if you'll hit that thing just right, it will cause a lot of times a spasm.
Yep.
And my suggestion would be next time you do it, poke around and find a spot that's not.
You mean with your finger?
With your finger, yeah.
Not with the needle.
Yeah, not with the needle. Yeah, with your finger, kind of poke around and palpate, mush until you can find a not real sensitive spot, and that's probably a better place to go in.
Yeah.
And I would, one other thing I would say too is he might be able to do it in his, if he's right-handed, do it in his right hip.
Yes.
The buttocks is where I would do it.
Well, I don't know if I
your
go with
leg.
the hip. I don't know. That's a tough one because you got to go to the right particular quadrant in that gluteus area. Mm. And I do think the thigh is easy to get to, but if you're right-handed, you can do your right thigh. Mm. Dude, that makes me wonder where he's injecting it.
Yeah, no.
So this is the correct way to do this. You should use the vastus lateralis muscle of the thigh. So let me tell you where that is. You divide the thigh into 3 equal parts vertically, not horizontally. So going from hip to knee, you draw a line from the hip to the knee, divide it into 3 equal parts, and you're going to go to the upper top part of the middle to lateral section. Mm-hmm. Okay, and then if you do that, there's no nerves and stuff over there, and that really, for me, That would be easier for me to hit from the right than from the left. Let me try it from the. I don't know. It's easy either way.
Yeah,
it's either way.
Well, there's cutaneous sensory nerves, but no.
Well, of
big nerves.
course, no. But I'm talking about there's the femoral arteries and stuff go on
that's
the
inside
part
of the leg. Right?
That's right. Yeah. That's right. Yeah, very good, Scott. You know your anatomy.
Yeah, buddy.
Give yourself a bill.
So, dude, if you want to email me, I'll send you a picture of where you need to be going.
Mm-hmm.
But Scott's right. Even then, like you can poke around, and if I poke just right, I can make that muscle spasm.
Yep.
It jerks. It's really a reflex jerk, is what it is.
And it's called a trigger point or a motor point if you want to kind of do a little research on that. But that's believe it or not.
I just looked on the camera. It looks like I'm masturbating.
Oh, funny.
Because I was poking my leg. And if I do that, it looks like. Can you see that?
That would be.
I'm sorry for the people who are listening.
And that would have been a whole lot more motion than you probably need. But
no, not for me. No,
anyway, but
I was in the bathroom at WRAL TV. A million years ago when I worked there, there was the weather guy was a guy named Bob DeBartoleben, and the news guy was a guy named Charlie Gaddy, right? Mm-hmm. And so they're both in there pissing at the same time. And the one guy, and this isn't a great joke, but it's just something that I remember. And Charlie Gaddy said, he bragging about what a giant cock he had, right? Mm-hmm. And he said, they need to lower this urinal for me, and Bob Bartleben, without even missing a beat, said, well, they need to raise it for me 6 inches off the floor.
You get nothing.
Oops, wrong thing, but it worked anyway.
Doing great with sound effects today.
I know, sorry, I was going for that.
Oh, good.
All right. Yep. Those were the good old days. Old Charlie Gaddy and Bob DeBartoleben, and doing championship wrestling on weekends.
Yep.
Ric Flair recently did, quote unquote, his last match.
Yeah.
And our buddy Shuli Egar was on the roast of Ric Flair.
Oh, my goodness.
And our friend Vinny Paulina was there to document everything.
How did the match go?
I don't know.
Okay.
He didn't die. All I know is he didn't die. I also hear that he was a complete you-know-what.
Oh, really?
Now, I worked with Mr. Flair for 3 years. Mm-hmm. Never spoke a word to me, not once.
Funny.
Now, I was a peon. I was just the audio engineer and sometimes cameraman. But, never. I don't think any of those guys would remember me. But I've got some great stories about working with them. That was
cool.
Wahoo McDaniel, Baron von Raschke. I've told the story about Igor the Polish Prince and his Polish sausage. Have you ever heard that? I've told you that story, Tacie?
I don't think I've heard the Polish sausage.
Do you know this
story.
one?
Yeah, I think so. Yeah.
This guy, his name was Igor the Polish Prince, and he had that sort of generic Eastern European, I am Igor, Polish Prince, like that, right?
Yep.
And he was from Kernersville, North Carolina, I think. I think that's where he was from. And he would get on, we would do these commercials, right? And there were we did 70 commercials on every Wednesday, 2 for each of 35 different markets.
Okay.
And they had the announcer, tonight in Dorton Arena, or tonight in Charlotte Coliseum. And then Blackjack Mulligan would get up there and he'd go, Wahoo McDaniel, if you're listening. Of course, he's listening. He's sitting right there because they're all on tables on either side of this thing because we had to get these things whipped out. Well, anyway, Mighty Igor would get up there and he would be gnawing on this Polish sausage. He'd never take a bite off of it and chew it and swallow it. Mm-hmm. He'd just gnaw on it, right?
Gross.
And it was just kind of gumming it.
Ugh.
And so that was every Wednesday. Well, I when I would come and do the morning show, which was at 6 a.m, so I lived in Athland, North Carolina. It was an hour away, so I'd have to get up at 4 to get there by 5 so that I could set up for the show at 6. And one day I was cleaning up the living room set where they all sat and did this sort of chatty show, farm show in the morning. And I'm cleaning the sofa, and I lift up the cushions to clean under the cushions, and there, lo and behold, was Mighty Igor's Polish sausage underneath one of the cushions. And what this guy was doing was when we would be done, he would shove that thing under the cushion. And then when he'd come back the next week, he'd grab it and stick it back in his mouth and gnaw on it. Now I understood why. No, yes, of course. What else? Why other reason would it be there? There's trash cans everywhere. He could have just thrown it in the trash. He was saving it for next time.
Oh my, that's awful.
So it was so great. I have a million of those stories with those guys. But anyway, maybe we'll do a wrestling show sometime. All right. So insane muscle spasm. We done with that one?
Yep.
Okay. Let's do. Oh, here's a good one, and Dr. Scott can talk about this.
This is Wade from Louisiana.
Hey, Wade.
Was laying in the bed, sleeping, had some kind of upper respiratory thing. I was coughing and tossing and turning, and I woke up about 2:30 in the morning with a serious case of vertigo.
Okay.
Went to the ER. They really didn't do anything but give me something for motion sickness. I come home.
This pisses me off.
I actually did the Epley maneuver.
Why? Okay. Why does this guy have to know and do the Epley maneuver?
Yeah.
You know what I'm saying?
Yep.
We're going to talk maybe next week. We might get Gina Levy on here about how she was treated when she had her mastectomies for pain. It was unbelievable. Excruciating pain. I don't know if they gave her anything. We're going to talk to her.
Oh.
Because she's been complaining about it online. I said, I pulled a trick like one of our friends online. Hey, Gina, come do my show. Certain people will know the joke behind that. But I did that. And so I think rather than have her call in the voicemail, we'll just have her on. That's Bob Levy's wife. And we love Bob. Bob's a friend of the show. So anyway, but yeah, this kind of stuff is starting to piss me off more and more.
And it cleared up shortly after that.
And have you seen the video? We got to do this one on this show too. The video of the woman that went to the ER and had monkeypox, and they said they'd never heard of it. Yeah. And
my goodness.
Yeah, and then she went to her primary. She said, I think I have monkeypox. They're like, we don't know what you're talking about.
Oh, for God's sakes.
It's like, do you not watch anything on the news? Do you not read
I told you.
I know, honey, I'm telling you. Every state sends out the monkeypox and COVID advisories. Nobody reads anything.
I think we're at 50 today in the state of Tennessee.
Ooh.
I think.
Okay, that's some emergency. But anyway, we'll talk about that in a minute. When the WHO declares an emergency, all they mean is that countries who are friendly with the WHO should now start reporting cases to them. That's all that means.
So go back to this guy.
Yeah, okay, sorry.
And this maneuver.
So he goes to, and we'll talk about what the maneuver is. So let me back up a little bit. So he goes to the emergency room.
They really didn't do anything but give me something for motion sickness. And I come home and
that what they probably gave him was meclizine.
Meclizine, yep.
Yeah.
I actually did the Epley maneuver, and it cleared up shortly after that.
Well, there you go.
Which was hours and hours later.
Give yourself a bill.
I was wondering if the coughing and the tossing and turning combined is what caused the little crystals to break loose.
See, this guy knows everything.
Float around.
Okay, we're gonna have to back up and tell everybody this guy's a damn genius. So.
Yeah, he's figured it out.
So
I guess his question is though, and he is correct, I think, in his assumption.
Yeah, he's wondering if the cough. Okay, so talk about benign positional vertigo for a second.
BPPV.
There you go.
It's an inner ear problem. It's the inside your ears. You have these things called the semicircular canals.
Right, they're the inner ear.
Yeah, and they're three little kind of tubules that have fluid inside them with little hair-like follicles. And when you move,
and they're oriented in 3 dimensions, which is fucking genius. The way that this thing is, because they detect acceleration.
Mm-hmm.
So way before Newton invented calculus, and Zeno talked about absolute motion and stuff like that, the semicircular canals were already analyzing in an analog computer type way acceleration in 3 dimensions. So go ahead.
Yeah, and what happens is...
I will give whoever designed these things one of those.
But
it's brilliant.
Yeah, but the cool thing is that they have fluid inside them, but they're not completely full. So when you move, the fluid moves around, and the little hair follicles can detect the motion and sends a message to your brain, say, "Hey, we're moving right or left or forward, up or down, whatever."
And the fluid moves,
right,
and it has momentum too. So when you spin on a bar stool and then stop, the fluid continues to spin, and that's what makes you dizzy. But anyway, go ahead.
It's actually pretty incredible. But there are some little calcium crystals inside those, and they can become dislodged.
Yep.
And when they do, and typically it's from a head injury. You can get conked in the head or some violent kind of motion.
It's going to happen when you got terrible, racking and cough.
Yeah, coughing and shaking your head back and forth. And he probably just dislodged those crystals and subsequently gave himself the BPPV.
Yeah.
Yeah.
And so you do the Epley maneuver, right?
Do it. Yeah, we do it some. And it's a, gosh, I would hate to try and do it, by myself when I was having vertigo, and just be sent home from the emergency department and say, hey,
you can do it though.
You can.
I have people with benign positional vertigo that I teach them to do it at home.
Well, especially after the first time.
Yeah.
But you would hope somebody would help them do that, while they're in the certain.
Well, he called us. I wonder if he heard about it here or if he's just already knew about it. But do you want to walk people through the Epley maneuver, or do you want me to?
Well, I've got it right here. I was just going to read the steps. I was going to.
You could have pretended you just knew it off the top of your head.
I know, but I don't want to screw it up. But you do. You've been sitting on the bed.
Mm-hmm.
Turn your head to 45 degrees to the right.
Yep.
You lay back quickly, keeping your head turned. Now, when you lay back, your head should be a little extended back over a pillow.
Yep.
And then what you're going to do is you're going to flip your head after 30 seconds.
Wait 30 seconds.
Yeah, 30 seconds or so. Then you flip your head to the other side, the left side, and do the same thing. Wait for like 45 seconds. Turn it back. And what you're trying to do is dislodge those crystals or put them back in place.
Yeah. And that's it. Okay, so if it's your right ear. If it's left ear, you do the opposite.
Right.
And you guys aren't going to remember this, and I'm not even sure that us describing it is sufficient for you to do it, but just know that it's there. Mm-hmm. And if you have positional vertigo, you can try this at home. You really can't hurt yourself. You just don't want to. You don't want to pull a Bob Saget, and no, I'm serious. No disrespect because I loved Bob.
Oh gosh.
And when you lay back, make sure your head is going to hit your pillow and not the back of your bed. Mm. Some of these hotel beds, I've seen this before, where the hotel beds have kind of like a sharp wooden. Like a beam or something on the back where the pillow goes, and it's really easy. If you lay back too fast, you don't realize how much force that is because you're used to doing it on a pillow if there's something hard and sharp there.
Yep.
Horrible. I mean, I love Bob, so I'm just saying, if you're going to do this, be safe doing it because we don't want what happened to you to happen to Bob Saget, even though Scott apparently thought that was hilarious because he was laughing.
No, I wasn't laughing at him.
I know, you were just saying how ridiculous what I was saying was, but just Google Epley maneuver, and if you really want to do it right, just look at it on YouTube, and they'll show you how to do it, and you can do it at home. But just be safe when you do that first laying back fast. You got to make sure that pillow's in the right place and that there's nothing hard back there.
Yeah, and you don't want to extend your head back off the bed,
right,
and wreck your neck that way too.
Right.
Yeah, so it's you have to pay attention.
Okay. All right. So, I think that's what happened. Now, if you've been coughing and you get vertigo that will not respond to the Epley maneuver, you may have another thing altogether, and that is called semicircular canal dehiscence syndrome. And semicircular canal dehiscence syndrome is a real problem that can only be treated with surgery. And dehiscence just means when something comes apart. And so you can have, the coughing, the pressure can actually cause the semicircular canals to be damaged. And that's a whole different thing. This guy got better with the Epley, so I don't think he had that, but I'm just throwing that out there. This is a rare syndrome. But if you ever get COVID and you cough for 6 weeks like I did, and you start seeing stars when you cough. That's how bad it is. Sometimes things can happen, and that's one of them.
Yeah, and as Amanda so poignantly says, and make sure they don't have a neck injury, especially like a multi-level spinal fusion. You don't want to be doing that.
Yes, of course. Yes, thank you, thank you.
So that is correct, Amanda.
Yeah, and as a matter of fact, don't do any of this shit without talking it over with your doctor first.
We're just a bunch of old clowns.
Yeah, we sure
Bunch of
we are.
hillbillies.
We don't know nothing about nothing.
Don't know much about nothing.
All right. You'd be crazy to do what we tell you to do. All right. Let's see what this is.
Hey, Dr. Steve. This is an old friend of yours calling. I won't say my name. I know you know who I am by now. And I just want you to know it's just a hello call. It doesn't mean a thing. I don't need any money, and I'm not in trouble, and I have no medical problems. So I'm not calling about free advice or cash or anything like that. It's basically a love call, Dr. Steve. It's an old pal of yours. I won't say my name because I don't want to make any trouble or anything. But you know who I am. And we go back. And it was a hell of a trip. What a wild, crazy trip it was there in the old chapel of UNC North Carolina RTV&P department, where we had so many laughs and so many wonderful experiences with professors that we were lucky to be around. I'll tell you what, more better than we deserved, as they say, Dr. Steve. Dr. Steve, I'm not going to hold you on the line very long because I know you got a lot of messages.
Yes, he is.
Okay, this call is 4 minutes long.
The basket is filled, not taking any messages. I know you won't let that go on like that for very long because that's just downright rude. You got the technology, you have the phone, and you haven't bothered to go in and Dr. Steve, that's not like you. I hope it's not an indicator that maybe your life's kind of, gone awry, as they say. Hope you're hanging on to the home fireplace, the home mantle there, and I know you are. And the ship.
We'll play part 2 next time.
Yeah,
Good Lord, Dave.
We're running late.
That's my old buddy Dave Haynes doing another one of his characters. He used to call in. Do you remember, Tacie, you might remember this, when some of our callers got through to Big Kev? Big Kev's geek stuff used to be, we used to share Saturday Night Virus with them.
Okay.
And some of our callers got through to him by accident, and so he played them and goofed on them, right? Mm. And then my buddy Dave started calling him, well, that old Big Ken or Big Keg or something. I can't remember what he called him. And he would goof on him, so I didn't have to. And he would pretend like he was somebody calling Big Kev's geek stuff. And that's the same guy. So anyway, he's a damn nut. All right. Absolutely my best friend from the 1970s. Let's see here. You want to do one on neutralizing antibodies? We could do that. Let's do this one.
Hey, Dr. Steve. I'm having a question about the COVID antibodies.
Okay.
So I currently have an autoimmune disease, and I have received the Moderna vaccines 1 through 3. My rheumatologist in Cleveland decided for me not to get the 4th booster until we checked my antibody levels.
Okay.
Because I had such a rough time with the 3rd Moderna, high fever, chills, body aches, just really severe reaction, and it increased my inflammatory markers.
I wonder if the reason she had such a rough time was because maybe somewhere in there she'd actually gotten COVID, but let's see.
So I had my last antibody screen showed that my numbers were at 50,000. 8 weeks later, they're at 25,000. What is the magic number of...
Okay, we're running out of time, unfortunately, so I'll give you the quick answer. It depends on the units. Again, the normal units in international units per milliliter, the neutralizing antibodies are like 448. So I'm assuming they are using different units when they're saying that her antibody level is 50,000.
Yeah.
So if it were 50,000 international units per milliliter, I would say, well, yeah, you're in great shape. But if you will email me and send me the actual lab work, I'll look at it and I can calibrate it with, I can convert it to these units and see where you are. But as it is now, this is that same problem, with different labs reporting things with different units. I don't know what units they were using. Okay. All right. Dr. Scott, you got any other questions for us?
Yes,
from the waiting room.
From the waiting room, yes. So Cindy Walker asked if Tacie's vaginal treatment was still effective. And if it's been, because it's been a month or so since we've spoken about it, maybe 2 months or something. So,
yes, it is.
Update.
It is still effective. But
okay, so there are people who don't know what we're talking about, so just give them the Reader's Digest
I'm
version.
not exactly sure the one that I had done.
Well.
So
okay, you had radio frequency and microneedling.
Radio frequency and microneedling, but I'm not exactly sure the name
fine.
of them. Okay,
it's called Votiva, but it doesn't. That
okay,
part doesn't
thank
matter.
you.
Yeah.
So anyway, yeah, I would still do it again. I'm not going to the bathroom as often. I'm not getting up in the middle of the night as often.
And when you laugh at my jokes, do you still piss your pants?
No, because I'm not laughing. But yeah, I would absolutely do it again.
nothing.
But I don't know how it compares to like true surgery.
Well, you wouldn't, but they're not asking that though. So you had some stress incontinence. Is that fair to say?
Yes.
And can you tell any difference in that?
Yes, I can.
Okay. So and how many treatments did you have?
3.
You had 3, each lasting for how long? Each time?
Well, you go in and you do the numbing for like 30 or 40 minutes.
How do you do the numbing?
Well, they use this. They stick like this bullet thing in you, and it does like Kegels with numbing cream all over it, so it numbs everything that way.
So it stimulates you electrically to contract the pelvic muscles?
Yes,
really?
yes. That's how they numb you, and then they get in there with that wand and they do the work.
Yeah. Is it painful when you have it done?
Yes. If it's not numb where they do it, then absolutely it's painful.
Okay, so how much of you wasn't numb after the Kegel machine?
Well, the last time I had it done, I was not as numb on the outer area as I was
I can't imagine the outer area.
And yeah, so they didn't go as hardcore on me, but yeah, it would have seriously
you would have jumped
hurt.
off the table.
Yeah.
On a scale of 1 to 10, where the numbing was when you were having this done, where would you rate your pain? With 10 being, they're chopping off your leg with a rusty saw.
1 or 2. It was
really?
Nothing.
Okay.
Nothing. It was not even that.
So it's very tolerable.
Yeah, it was just more embarrassing than anything.
Yeah, sure.
It's like going to the dentist when they have that ultrasonic kind of cleaner thing that kind of zaps you.
I mean, you don't.
This has little needles in it, though.
Yeah, needles, and through the needles, apparently, radio frequency comes.
Okay.
And if I can't,
gosh, I wonder where they got that idea from.
Well, okay. So they're ripping me off, Rob.
Man.
Can I say the difference that I saw, or no? Should I just keep my mouth shut?
Sure, if you want to.
Well, it felt like. Gosh, how can I say this
bragging.
without being gross? No, not at all. The 2 weeks after you did it, it felt sort of like you were ribbed for, where they used to have those condoms that say ribbed for your pleasure. Mm-hmm. That's what it felt like. You could tell that it was concentric rings sort of.
You think it's from the inflammation where they did the needles?
Well, yeah. I mean, it causes increased blood flow.
Yeah. Interesting.
So that was interesting. I did notice that. So good.
So there.
So would you recommend it? That's the question that they're asking.
It's I'm glad I did it.
It doesn't listen, if you have a giant cystocele, which a cystocele is where your bladder is actually dropped because the bottom part of the bladder is top part of the vagina, and if the vaginal wall has become so thin, the bladder can sometimes drop into the vagina. It's called a cystocele, and sometimes it can get so bad that you can actually see it from the outside. And I don't think this would solve that problem, but if you are relatively young, as Tacie is, and starting to notice that your control quite isn't the same, because women have a problem because there's just like an inch from the outside to the inside. when it comes to the urethra, whereas guys, like me, it's at least 10, 12, inches from the outside to the inside. So, it's a lot harder for urine.
It was really starting to bother me, and now it's better.
So you're happy?
Mm-hmm.
All right. So it was worth it, and you did no surgery.
No surgery.
Okay, good.
Cool.
Who was it that was asking about that? Oh, don't say it, because then she'll be embarrassed. Because she was just asking for a friend.
Oh, Cindy.
Yeah. Okay. Yeah. And Cindy, if you do it, let us know.
Yep.
And if
she was wondering if we thought it might help with vaginal atrophy as well.
I'll have to look at the data on that. It does increase blood flow, and it increases stimulates some tissue growth.
We can say hypothetically,
but I don't. If you'll email me, I'll get you some data on that. I can find it. What really works for vaginal atrophy, though, is estrogen cream. Yeah. All right.
Yep.
Any other questions, comments?
Nope.
That's it.
Are we good? Everybody happy?
I'm happy.
Are you happy?
I'm
happy and hot.
Yeah, right.
You are hot.
Wrap it up, and
you're gonna get you.
It is 90-something
You're gonna
degrees
get you
in this
some.
room.
That's what she said.
Mhm.
That
It's
doesn't
'cause
even
of
make
you,
sense.
Steve.
That's right. Well, thanks always go to Dr. Scott, and thanks to Tacie. Thanks to everyone who's made this show happen over the years. It has and continues to be the most fun I've had in my 6 decades of existence, outside of my marriage, obviously. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern. I think they just changed this, by the way. Just listen to it on demand. That's the best thing to do. If you have SiriusXM, you have an online subscription. Just go on demand. And other times at Jim McClure's pleasure. Many thanks to our listeners, whose voicemail and topic ideas make this job very easy. Go to our website, drsteve.com. For schedules, podcasts, other crap, check out Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody. And see, I cut out all the shout-outs, Tace, just
Way
for you.
to go.
If you didn't hear your shout-out, you can thank Tacie for that.
Thank you. You're welcome.